Researchers at Joslin Diabetes Center have solved the mystery of why some people who achieve tight glucose control are at increased risk for cardiac events. They saw that levels of a hormone called GLP-1 were lower in those people at high risk for heart disease. This finding provides more proof that people respond differently to treatments and will further the push towards personalized medicine.
GLP-1 is a hormone that is produced by the intestine in response to a meal, and its main action is to stimulate the production of insulin by the pancreas, so that it facilitates the uptake of glucose by the tissues.
In addition, GLP-1 also directly acts on the heart and the blood vessels due to its anti-inflammatory properties, antioxidant properties. It basically is proposed to be cardioprotective in nature.
People whose risk for heart disease increased when they tightened their glycemic control saw a decrease in this heart protective hormone. This study was a follow-up to previous research that discovered certain genetic differences in the people at higher risk for cardiovascular disease.
We had identified 2 genetic markers that were specific for people who would respond to intensive glycemic control with a paradoxical increase in cardiovascular events.
Dr. Doria and Dr. Shah analyzed 65 different biomarkers to figure out which ones were associated with the genetic variants previously discovered. They discovered one genetic marker was linked to GLP-1. They plan to investigate biomarkers associated with the second genetic marker in a future study. Once this finding is confirmed in the real-world setting of the Joslin Clinic, doctors will be able to screen people for these genetic markers and create a treatment plan accordingly.
We could use some new drugs which are called the GLP-1 agonists, which are like GLP-1. They have the same actions. So basically we can replenish the body with this drug, and therefore we can achieve low glucose without exposing people to this risk.
This approach is known as personalized medicine.
In the next few years, probably going to change the paradigm of medical care, because we're talking about customized, tailored treatments to the individual.